In early stage Parkinson's, a person usually takes medicine 2 to 3 times a day.
This may feel pretty normal. They may not even notice the symptoms of Parkinson's. In mid-stage, things are different. The disease affects your movements and a lot more.
This makes managing medicine more complicated. Your care team wants you to have the best control over your Parkinson's symptoms with the least amount of side effects. Not everyone will have side effects. For some, side effects will be mild or even go away.
Medicines are important because they help control your Parkinson's so you can stay active and independent. It's vitally important that you keep moving. The saying, if you don't use it, you lose it, is true in Parkinson's disease.
Let's look at the different types of medicines and their side effects. The side effects we'll discuss are only the most common ones. You won't know how a medicine affects you until you try it.
The best medicines we have for Parkinson's are those that replace dopamine. These type of drugs include Carbidopa-levodopa, Rytary, and other levodopa formulas. Levodopa is the drug that's usually given for Parkinson's disease. It's a natural chemical. It goes from your gut into your blood and then to your brain, where it's changed to dopamine.
Levodopa can be short-acting or long-acting. In addition to the pill, it also comes in a form that can be breathed in and a gel that's pumped into the gut.
Researchers continue to study new ways to get levodopa into the body. Feeling sick to your stomach is a common side effect of levodopa. Carbidopa helps with this, and most levodopa medicines also contain carbidopa.
Protein can get in the way of Carbidopa-levodopa working. If you eat a meal that has lots of protein, like meat or milk, take levodopa 1 hour before or 2 hours after eating.
If you get an upset stomach, take the drug with foods that don't have protein, like soda crackers or applesauce. Iron can also get in the way of Carbidopa-levodopa working. Make sure you take this medication at the same time each day. This will give you the most benefit and make it less likely you'll have off time.
Carbidopa-levodopa may cause nausea or vomiting, lightheadedness, dizziness, blurry eyesight, trouble pooping, dry mouth, tiredness, seeing things that aren't there, and wiggly movements. The color of your spit, pee, or sweat may become darker. It may also lower your blood pressure.
Another type of Parkinson's medicine is called dopamine agonists. They act like dopamine. They include ropinirole, pramipexole, rotigotine, and apomorphine. Your doctor may give you these drugs when you first have signs of Parkinson's, but more likely you'll get them after you've already been taking levodopa for a while. These drugs can help with wearing off.
They have the same side effects as Carbidopa-levodopa. Agonists can also cause too much shopping, eating, gambling, and thinking about sex.
If you have any of these side effects, tell your care team. They can start right away, or they may not show up for years. Other side effects that might happen are being very sleepy during the day, seeing things that aren't there, confusion, and leg swelling.
COMT inhibitors act like dopamine boosters. They help levodopa work better by getting more of it to the brain. They can make off time shorter and on time longer. Taken alone without levodopa, these medicines don't help with Parkinson's. You have to take them at the same time that you're taking the levodopa.
These drugs include entacapone, tolcapone, and opicapone. Stalevo is a combination of carbidopa-levodopa and entacapone. Side effects include confusion, seeing things that aren't there, diarrhea, and a change in the color of your pee.
MAO-B inhibitors are drugs that make it so the dopamine in your brain lasts longer. They can't be used alone in early-stage Parkinson's.
More often, they're used in mid to late-stage Parkinson's to make off time shorter and on time longer. They don't slow down the disease like we used to think they did. Examples of these medicines are selegiline, rasagiline, and safinamide.
The most common side effects of MAO-B inhibitors are feeling sick to your stomach, dry mouth, lightheadedness, and trouble pooping. You shouldn't take these medicines together with certain other medicines, like some cold medicines and some antidepressants.
Talk with a pharmacist before you start taking an MAO-B inhibitor or an antidepressant. Amantadine, Gocovri, and Osmolex are drugs that are often used to treat wiggly movements. Gocovri and Osmolex are newer, long-acting forms of amantadine.
Like most new medicines, they can cost a lot of money. Amantadine can also be used to treat mild signs of early Parkinson's like tremors, but it stops helping after a while.
Amantadine's most common side effects are feeling sick to your stomach, dry mouth, lightheadedness, trouble sleeping, confusion, seeing things that aren't there, changes in how much or how often you pee, trouble pooping, leg swelling, and purple webbed patches on the skin on your legs. A rare side effect is blurred vision. Blurred vision will go away when you stop the medicine. If you have kidney disease, you may have to take less of this medicine.
It's very important to tell your care team when and how much medicine you're taking, any side effects you're having, and when they happen. They need to know how long after taking your medicine the effect happens. That's how they will know if they need to make changes to your medicine.
If your off time is very bad, there are some things that you can do to help. First, try chewing a half tablet of Carbidopa-levodopa and swallowing it with fizzy water. This is an easy way to treat off time.
You can also try other newer drugs, but they cost more, take about the same time to work, and don't last long.
They include a form of levodopa that you breathe in called Inbrija, and a film that you put under your tongue called MAO-B. Managing peak dose dyskinesias can also be hard. Your doctor may start by giving you less levodopa or taking out other drugs.
Sometimes adding Amantadine can help. The challenge is to give you enough levodopa to make you feel better, but not so much to cause the wiggly movements. It can be a trade-off.
Dystonia is when your muscles tighten up for no reason. It can hurt. How to deal with this cramping depends on when it happens. If it happens in the early morning, your doctor may add levodopa or a long-acting dopamine agonist at bedtime. Or they may have you take levodopa between midnight and when you get up.
If the dystonia happens when your medication is wearing off, or before it kicks in, your doctor may increase the dose of levodopa or have you take smaller doses more often.
If cramping happens a lot, and not because of when you take levodopa, then you may get botulinum toxin shots. Botulinum toxin works by making the muscles weak for a short time so they don't tighten as much.